Hi, this is your Houston chiropractor, Dr. Gregory Johnson. We have Dieter in here with us this morning, and as you can tell, Dieter is a crack addict from San Antonio. And I want to give a big shout out to his chiropractor in San Antonio, Dr. Chad Carpenter, who is the next president of the Texas Chiropractic Association. He's a great chiropractor, and he's going to be a good leader for our profession. Dieter comes over to us complaining of low back pain and left sciatica that goes all the way down to his calf, back behind his knee. He has some numbness and tingling, which is called paresthesia, that also goes down to his left leg. Now he's got some mid-thoracic spine pain because he had a compression fracture due to a motorcycle accident back in 1998. 1998. And he wore a brace for 6 months following that. And Dieter did the right thing. He brought his x-rays over here for us to look at. This is a lateral view of the cervical spine, and you can see that his curve has straightened out from normal. It should be a nice 63-degree radially loaded arc forward, and his has straightened out from that. That's why he has that forward head posture. This is his thoracic spine. He's starting to get an increased kyphosis in here due to this old compression fracture right here at T6. This is an A to P cervical, and you can see, whoops, if I quit touching the screen better, you can see that he's translated and curves out to the right. He's flipped around in this, so this is left and this is right. And this is his lumbar spine. As you can see, this ilium is higher on the left side, so his spine deviates off to the right side. This is a side view of his lumbar spine. Now he's getting his sciatica right down here at L5, which the disc is beginning to degenerate down there. And also, he's got what's called retrolisthesis. The vertebra has slipped backwards and is pinching on the L5-S1 nerve that's going down into his leg and causing his sciatica. That's why I do the drop adjustment on the lumbar spine, because I adjust P to A, which is posterior to anterior, pushing that vertebra back forward so it takes the pinching off his sciatic nerve. Now, he's had some decompression therapy, I believe, at Dr. Carpenter's, right?
Yeah.
Yeah, and that helped you.
Yeah, absolutely. Better sleep.
Yeah, slept better the first night. But he's going to get the ultimate decompression here today, the ring dinger. He's been looking forward to that. You can see also his A to P thoracic spine. He's got some degenerative disc disease in the mid-thoracic spine region, in and around the surrounding and adjacent vertebrae to T6. And he's got a little bit of a curvature through there. That's a minor scoliosis. And that's all of those. Thank you for sharing those. Appreciate that. And if you come here from out of state or out of town, or out of the country, bring your MRIs, x-rays, or any diagnostic studies that you have, physician's reports, medical history, anything, because that's all important in me determining the diagnosis and treatment of a patient. So thank you for bringing that over, Dieter. Let's show them how we're going to adjust you today. I'm going to have you close your eyes and flex your head forward and backwards. And then neutral. You know, you're probably going to get a lot of people wanting to buy that t-shirt, right? So right now I'm analyzing his posture on the X, Y, Z axes. He's forward in the Z axis in his cervical spine with the flattening out of his cervical spine curve from the side. His pelvis is also shifted to the right of center. He's got less room over here on the right than he does on the left side here. That's called translation. Okay, so first thing we're going to do is we're going to set you down here, right here, and face that way for me. There you go. I'm going to do a couple of tests on you here first. These are called orthopedic neurological tests. Tell me if this hurts anywhere in your spine.
Not in my spine, just in my sciatica.
In your sciatica, so it did hurt down. Yeah. And how about over to the right? Same area, down low. And how about this side?
Little pressure
in the upper back. Okay, if you tilt this way, does this tighten up?
Yes.
Does this make that worse?
Yes.
If you go this way, does this one tighten up?
Yes.
Does this make that worse?
Yes.
Okay, here's a really important question. If I lift straight up on your skull like that, does that feel better, same, or worse to your spine and your sciatica?
Makes my sciatica inflame a little bit.
It
worse.
does? Okay.
Yes.
So I'm gonna push down, resist. Same thing here, resist. Yeah, this one's a little weaker. Okay, I'm gonna pull out, resist. Now I'm gonna push in, resist. Excellent. I'm gonna pull out, resist. Now I'm gonna push in, resist. Excellent. Okay. Okay, relax your arm. There you go. Oh, there's a problem. Don't kick me with both of them. That's why I never stand out in front of a patient when I do that. I'd be talking in a higher voice than I already am. Okay, let's go ahead and lay you on your stomach for me here, face down in here. Arms can rest right down there for me, Dieter. Okay, left leg is a 1/2 inch shorter than the right leg in this prone position. Now when I bring your legs up, however, it gets longer. Does that tighten up in your lower back and pelvis?
Yes,
Thighs a little bit?
Yes.
So he's got left SI joint subluxation and right SI joint subluxation. Which one's the most tender? This one?
Left.
Left one?
Yes.
Okay, how about right there?
That's
That's L5. These are all a little tender, aren't they?
yes, it's just the muscles.
Yeah, the muscle, that's what I'm talking about, tightness. You get compensatory hypertonicity up in the lower thoracic spine, mid-thoracic spine. Yes, there's T6 right there. That's sore. You got some ribs out of place in here. You got some tight shoulders on you too.
I always do.
Yeah. Your neck's out right there and right there on the left. And then right there is where you, when you do get that, sometimes that dizziness goes right up from there. Okay, I want you to lock your right leg straight, lift your entire right leg up off the table. Does that hurt to do that?
A little bit, but not much.
Okay, do the same on the left side now. Yep, which one was worse?
Left.
That's what it looked like to me. So you have subluxation complex in your SI joints and your sacrum and the pelvis, the lumbar spine, thoracic spine and rib cage and your cervical spine. So I'm going to adjust you from your SI joints all the way up to your skull. And all you need to do for me, Dieter, is lay there and breathe and relax. Now this is the P to A adjustments I was talking to you about earlier, where I'm pushing the vertebra back forward. Yep. That's probably the sorest one right there. There you go. Mm-hmm. Yep, crack addict's gonna love this crack addict. Okay, you were 1/2 inch shorter, now it's exactly even. And I bet you this feels a little easier already than that first one did.
No pain.
Good. Okay, you're gonna feel your head popping up a little bit on this one. There you go, good. Okay, let's turn you on your back now. There we go. So I'm gonna bring your head up and back on the Z-axis. There. I'm not adjusting your cheeks, I'm adjusting your cervical spine with this one. Slide down this way just a little bit and put both arms straight out to the sides for me, please, sir. Palms facing up. There you go. Relax your hands right there. Now, I want you just to let this relax in my hands here. There you go. Now you should have felt that from your knee all the way up to that low back. Did you?
Yeah, oh yeah.
Okay, good. Same thing here. Just relax this. There you go. Super. Yep. That's the real deal, isn't it?
Wow.
Yep. Okay, let's set you up sideways, Dieter, and face that away. There you go. Has it been cold over there in San Antonio lately too?
Oh yeah.
It's finally starting to warm up a little bit here today, but it was still in the 50s this morning.
Houston feels good compared to San Antonio.
Yeah, you guys get a little more of that mid-Texas weather, central Texas weather. It's just usually a little colder than it is here in Houston, Austin, San Antonio, San Marcos. Okay, good. When I did that move where I lifted straight up on your occiput and asked you if you felt any better or same or worse, and you said you felt that right down there at that sciatic nerve.
On the left, yeah.
Yeah, that's, even though that didn't alleviate the pain, it still shows me that's the cause of it. So I'm gonna bring you over here on this table now. And we're gonna lay you on your back with your butt right here. Head up this way, please, sir. There we go. There we go. Slide down a little bit. That's it. Get you in there, tighten up. There you go. Put your hand there. Now this is what I was talking about, having your legs up parallel with the floor, relaxing your paraspinal musculature. Does this hurt to do this?
No.
Okay.
Tight, but not.
Okay. So I want you to keep your teeth together on this one. Breathe through your nose. Yes, sir. Home run. No, I know you felt that one all the way down. There we go. Okay, I got you. That's it. Dropping my hand. I'm putting your cervical curve back in there, multiple dimensions on the X, Y, and Z axes. Yes, sir. That's a wow adjustment.
Everything bumped.
Yes, it did. Everything. There we go. Okay, turn sideways and push yourself up with your left arm. And then we're going to stand right here in front of the mirror for me again. Okay, let's have another look at you here now. Flex you forward and backwards again. That's a lot better. Take a look at your posture right now. See, your head's not near as far forward right now. It's back here now. So it was up here. So here's your homework though. You still need to do this at home. Pull your shoulders up and back. Flare these way back here like this. Now I don't want you arching your back because that'll pinch on your SI joint a little bit more, but bring your head straight back and then look backwards at the wall behind you. Feel a little tap there. Another one there. Okay, relax. And let's have you flex your head forward and backwards again. That should have felt smoother to you that time. Yeah, and look at your posture right now. Look at the space we opened up here on the right side. That's better. Walk around and tell me how that SI joint and sciatica feels right now.
Oh, a lot of relief.
Relief?
Oh yeah.
Good. So is it worth the trip from San Antonio?
Every single mile.
Okay, good, good. Well, thank you for coming in and sharing your experience with everyone. And again, shout out to Dr. Chad Carpenter in San Antonio, Texas. This is your Houston chiropractor, Dr. Gregory Johnson, coming to you from Advanced Chiropractic Relief in Houston, Texas. We'll see y'all soon.